So my name is Danielle Jones, and I am the manager for the Academy of American Family Physicians Center for Diversity and Health Equity. And so in that role, I'm really in charge of setting the direction that the board has kind of established for the Academy on being a leader in the field of diversity and health equity. So just as recently as this past spring when our center launched, some of the 4 priority areas that we decided we were really going to focus on was going to be around the workforce development piece, so increasing the number of diverse family physicians in the workforce, and then also doing training around diversity and health equity issues, so that everybody can be kind of working from the same page and same mindset, providing the same perspectives on these topics. We've got a huge piece of advocacy working with our government relations staff that are in DC. So when we consider advocacy, one of our big things that we want to focus on is around health in all policies, the idea that all policies should be healthy policies, whether they're health related or not. So if it's tax policy, education policy, that those are looked at with the lens, preferably a family medicine lens, as how those are actually impacting the communities to which those laws and bills and resolutions are actually being applied to. Another big piece is the research part. So one of the things we're really trying to drive is the evidence, not only for health equity around social determinants of health, that they have an impact on health. And so to do that, we are doing our own research internally with our national research network that's housed with the Academy, but also working with all the other research partners in family medicine on how do we support this from a perspective that it actually has an impact on health and then healthcare utilization and cost. And also around the piece about payment, so that when providers are using these services or making these recommendations to their patients, that there's incentive for them to keep doing that there's a payment piece attached to that. So those are really the 4 areas that we're working in with the center, and then also just the multi-sector collaboration. So we have great collaboration within the family of family medicine organizations, everybody that's represented with the FMA health team. But looking to look outside of that with organizations that might not be in medicine. So people in the justice field, people in the education field. How do we develop those multi-sector, interdisciplinary partnerships with organizations that don't normally either do work in the health field or health equity work in general, so that we can kind of develop this really synergy around some targeted initiatives that are going to improve health in specific communities.